My name's Dr. Eric Williams. I'm an allergist and immunologist at Allergy Partners of Rowan Salisbury in Salisbury, North Carolina. And I've been using the MiniBox now probably for the past 4 to 5 years. As an allergist and immunologist, I'm often asked to evaluate patients who have shortness of breath, wheezing, coughing, chest tightness, these sort of typical lower airway symptoms. And these symptoms are not necessarily specific for one particular disease state, and that can make diagnosis challenging at times. And so what I really like about the MiniBox is that it really improves my diagnostic capabilities. I think that having full pulmonary function testing and having full lung volumes is important as I'm following my patients with COPD and as I'm following my patients with asthma. I can sort of follow their degree of hyperinflation. I think that being able to determine whether or not restrictive lung disease is present is also very important. I've sent several patients for chest CT and referral to pulmonology because of restriction that I've seen with full pulmonary function testing on the MiniBox. Those are diagnoses that I would not have been able to make if I was just performing spirometry. I think that it's important as we're evaluating patients for interstitial lung disease and COPD that we have a good understanding as to their diffusion capacity in order to make those diagnoses and get the patient to the appropriate provider to handle those disease states. So really just improving my diagnostic capability has been beneficial for my practice. It's been beneficial for me as a clinician, and I think it certainly benefits my patients. So one of the things that I appreciate about the MiniBox is its size. So when I send patients to the lab for full pulmonary function testing, and they go into this big body box, it can be intimidating, and it can also cause claustrophobia. So what I like about the MiniBox is that patients sit right next to a machine, and there's nothing that sort of encloses them. Because of its size, I'm able to take the machine to patients if the patient has difficulty ambulating. It's very easy to use. I've trained my staff, my medical assistants on using the machine, and that allows me to free up some time to actually see the patients while my staff are performing the full pulmonary function test.